Okay, so for this topic, we are going to discuss your trematodes. Your cestodes or your tapeworms have the same phylum together with trematodes, the phylum Platyhelminths. So your trematodes is under the class Trematoda or Digenea. So your trematodes are leaf-shaped, unsegmented, and flat. No, they are broad helminths. So unlike with your cestodes, they are segmented. So your trematodes is otherwise known as your flukes. It was called fluke from the Anglo-Saxon word flock, meaning flatfish. So it resembles like a flatfish. So if you want to see a picture of flatfish, you can search it on the internet. So the name trematode comes from their having large prominent suckers with a hole in the middle. From the word trema or Greek word trema, it means hole, and eidos means appearance. Okay, so as you can see here in the picture, this is an example of an adult trematode worm. So this one is a sucker, one of its sucker, and another one here. So we will discuss, what kind of suckers are these and uh, what are the functions of these suckers. Okay, so to classify them, we have the different orders under trematodes. We have your Strigada, Echinostomida, your Plagiorchida. So your Strigada has its superfamily Schistosomatoidea with the family Schistosomatidae and the very famous Schistosoma species. We have your Hematobium, Mansoni, Japonicum, Mikonki, and Intercalatum. Down to Echinostobida, we have the Paramphistomatoidea, we have your Zygocotylidae, we have your Gastrodiscoides and Watsonius. So these two will not be discussed in my discussion since this is not common in the Philippines. Echinosto Echinostomatodea, we have your Fasciolidae with the genus Fasciola and Fasciolopsis. Okay, and we have another one which was not included here. We have your Echinomastidae, no, still under this superfamily. We have your genus Echinostoma and the species Elocanum. Okay, so for your Plagiorchida, you have your Opistorchioidea and your Opistorchidae family. We have your Opistorchis, Philineus, and Viverini, and we have your Clonorchis sinensis. And for the family Heterophidae, we have your Heterophagis and Metagonimus. So these two are heterophagid flukes. Okay? So for your Plagiorchoidea, we have your Paragonymidae, we have Paragonimus westermani. So your trematodes are, or they can be classified based on the habitat or based on their organ of establishment where they tend to mature, no, inside the human host. So first, we have your blood flukes. No, blood flukes, they are so-called blood flukes or they are classified as blood flukes because all of them live in venous plexuses in the body of the definitive host. No, the location varying with the species. Like for example, for S. hematobium, they are situated or they resided in the urinary bladder or in the pelvic plexus near the bladder. And for the S. mansoni, we have the sigmoidorectal region. So definitely they are present on more on the large intestine. Okay, and we have your ileocecal region in S. japonicum. Okay, so for the lung flukes, we have your um, For the lung flukes, we have your Paragonimus westermani. For intestinal flukes, we have your Fasciolopsis buski, your Heterophagus, and Echinostoma. So these intestinal flukes, they are particularly established in the small intestines. But we have this one intestinal fluke which resides on the or in the large intestine, no, in the large bowel. It's your gastrodiscoides. Okay, gastrodiscoides. So your liver or bile flukes naman, we have your fasciola, your Clonorchis sinensis, and Opistorchis species. So for its general characteristics, all flukes, guys, except blood flukes, are flat and leaf-like. Okay, so first, they are flat and leaf-like. However, for your schistosomes, they are elongated and cylindrical, so they are more into roundworms. Okay, and second one, there are known to be hermaphroditic or monoecious. They are capable of self-fertilization, except for your schistosomes, which are dioecious and they have separate sexes. And for the eggs, we have that their eggs are mostly operculated. Okay, so the presence of operculum or the purpose or the function of operculum is it serves as a pathway, no, for the larvae to get out from the shell. And okay, so let's go back. So except for your schistosomes, which are non-operculated, so how can these schistosomes um, able to move out, no, from their eggs is that through the enzymes that they are being that they secreted. Okay, so enzymes that they secreted tends to degrade its shell. Okay, so for the mode of transmission, so most of them is via ingestion, except for your schistosomes via skin penetration. Okay, so the infective stage towards human host, we have your metacercaria, except for schistosomes, which are cercaria. So this cercaria, this is the one that able to penetrate, no, the skin of the human host, no, and the rest metacercaria through ingestion. Okay, so for the intermediate host, so all of them, no, all of them requires um, all of them except for schistosomes require two intermediate host. And take note that all of them naman niya, no, ang first gid nga intermediate host is snail. Okay? So since schistosomes have only one intermediate host, so definitely ang snail lang gid ang iya gina-require sa iya life cycle. Okay? And then the rest have the first intermediate host, which is snail, and then they vary on their second intermediate host. So let's talk about more on its morphologic characteristics. So for the adult, all flukes are characterized with two suckers. That's why it is described as dystomata. Okay, two suckers. So we have the oral sucker, which is used for digestion, and ventral sucker for attachment. The ventral sucker is synonymously known as acetabulum. Okay, so based on the picture here, we have the ventral sucker, ventrally located, and we have your oral sucker. So as you can see, it is present, or they are present in the middle of the adult worm or in the midline. So we have here an exception for your heterophagus, wherein aside from two suckers, it has as well third sucker known as the genital sucker or your gonotile. So most likely it is being used for copulation or for reproductive function. Okay, so for the digestive system of trematodes, it is incomplete. No, it consists of an anterior mouth with a muscular pumping pharynx here, and then which continues as esophagus. Then the esophagus will bifurcates into um, it will bifurcates in front of the ventral sucker, okay, which splits into a pair of blind intestinal pouches called ceca. So here and another one here. So this one is its intestine is blind, no? Since the anus here is absent. Okay. For the male reproductive organs, it consists of number of testes present near the cecal end, and then the vas efferens arise the from each testes joining to form a common vas deferens. So these are the testes of the adult worms. So as you can see, there is this duct. Okay, so this one, the sperm duct, this is the vas efferens. Okay, and then they will meet in a common duct, which is your vas deferens. Okay, so your vas deferens will run via a small seminal vesicle and opens at genital pore, or known as your gonopore, here near the ventral sucker. For your female reproductive organs, it consists of an ovary. It is present near the ventral sucker, with a vitelline gland surrounding ovary, oviduct, and ootype, and the uterus containing eggs. So here, as you can see, lapitay lang ang seminal vesicle and the uterus of of an adult worm. So this uterus will contain the eggs, no, and it will open as well behind the ventral sucker, which is the gonopore. So for the trematode eggs, okay, so all um so they classify, you know, they are classified as well according to to their embryonation. No, so for some of the trematode eggs, or for some of the adult worms, they tend to lay eggs which are embryonated, and we have as well those trematodes which lay eggs that are unembryonated. Okay, so for those capable of laying eggs or embryonated eggs containing the motile miracidium inside, we have your schistosoma, heterophyes, opistorchis, and your clonorchis. Sorry for the spelling of opistorchis. It should have an H here. Okay, opistorchis. So for the unembryonated, we have your fasciola, Fasciolopsis, Paragonimus, and Echinostoma. So as you can see here on the picture, um, it clearly shows that Fasciola hepatica and Fasciolopsis buscae, they're somewhat similar with each other, and they are one of the um, um, largest na mga eggs, no, present. And we have as well your schistosoma species, which have their distinct spines present on their surface. Okay, and we have the minute eggs of your Metagonimus, Heterophyes, together with Opistorchis and Clonorchis. Okay, so your adult flukes, no, your adult flukes, they tend to lay their eggs on the organ wherein they are established. So upon laying their embryonated or unembryonated eggs, okay, so these egg, if unembryonated, they tend to ano pa, to embryonate, no, to mature or forming miracidium inside. So this miracidium, no, this is a free swimming ciliated larva, no, so its cilia is used for its movement. So it contains as well apical gland, which releases proteolytic enzymes, which aids in the process of penetrating the intermediate host. Okay, So once the miracidium is present na inside the intermediate host, it transforms into sporocyst. Okay, so this sporocyst, guys, is an elongated sac without distinct internal structures. And this will undergo a sexual multiplication. Okay, um, this will undergo a sexual multiplication. Okay, so this one, um, um, in most of the trematodes, it has only one sporocyst generation. However, for the cases of schistosoma, okay, it happens to have a dual multiplication. So it gives rise to a second generation sporocyst for your schistosoma. Okay, and after the sporocyst, it will further develop into radiae that contain now a mouth, pharynx, blind cecum, and birth pore. Okay, so take note that for your schistosomes, no rhizia, no, there's no rhizia for schistosomes, but has two sporocysts and no metacercaria. No, so from sporocyst, it will develop into cercaria. Okay, that's for schistosomes. For your echinostoma, it has no sporocyst but has two rhizia generation, no? And and it will follow a normal cycle. Okay, so after the rhizia, we have your cercaria and your metacercaria. Okay, so that's the flow of their larval stages from miracidium, sporocyst, rhizia, cercaria, and metacercaria. Okay, so now to discuss the life cycle, the general life cycle of trematodes. So the mode of transmission is that man acquires infection by eating aquatic plants, fishes, or crabs harboring infective form, which is the metacercaria, or by the penetration of free-living cercariae for your schistosomes. So what is happening in the definitive host is that after the young trematodes will migrate to their habitat where they grow into adults, they are sexually mature and begin to lay their eggs, which are excreted in feces, urine, or sputum, depending on the species, guys. And for those unembryonated, they tend to gain access to water for embryonisation. And for those embryonated, still, they gain access to water, releasing their miracidia. Okay, so depending on embryonation, eggs showed three different types of development. Take note. So first, those eggs which are embryonated when laid, they tend to hatch to release miracidia, which infect the intermediate host. Okay, so that is for the cases of schistosomes and echinostoma. So embryonated na sila, so hatching to release their miracidia, and then they will penetrate. Okay, penetrate ha, extra or outside the intermediate host, nega-penetrate sila. Okay, sa skins ng snails, okay? So, for those naman eggs which are not embryonated, they first mature in water and then will hatch to release miracidia. Okay? And then the eggs naman which are embryonated when laid but no, tends to hatch only on ingestion by suitable snail. Okay? So upon engulfing um, upon ingested or upon ingestion of these eggs by the snail host, that's the time pa nga ma-hatch siya sa sulod na sang intermediate host. And that is for your Clonorchis, Opistorchis, and Metagonimus. After they are now present no, inside the first intermediate host, in the liver or lymph spaces of the snail, the miracidium transforms into sporocyst. Okay, so asexual multiplication, no? So that's for your schistosomes. Okay, nagkatuway siya, guys. Then the sporocyst will develop to become radiae, and then the radiae will multiply to produce second generation, and then transforming into cercariae. Okay? So based on the morphology of the tail, we can divide or we can classify your cercariae, okay, into four types. Take note. So first, we have your fluorocercus cercaria, which has an elongated body with forked tail. So that is unique for your schistosoma. That is that is the cercaria associated with your schistosoma. Okay, fluorocercus. And we have another one, your microcircus cercaria, which has an oval body with short, stumpy tail. For your for the third one, we have your Lophocercus cercaria. It is armed with spines and has a large fluted tail and conspicuous eye spots. So it's kind of narrow tail. It has a narrow tail. And for the last one, we have your Pleurolophocercus cercaria. It is as well armed with spines. However, its tail is long and it is keeled. Keeled, Keeled, no? So it's like a tadpole tail. Okay? So um after the cercaria, um, these will attach to fish gills or in carp or related species. It might be they will they are present, no, or they will tend to infect fish, crabs, no. We have also another snail, possible man na siya guys nga snail ang second intermediate host or in the freshwater vegetation. So the cercaria larvae will develop into metacercaria, which are now the infective forms to the definitive host in most of the trematodes. Then the cycle will will start again after infecting the definitive host. Okay. So let's start with blood trematodes, okay? Your blood trematodes, guys, we have your schistosomes, okay? They are the most romantic parasites and mainly the species infecting humans are categorized into African and Asian schistosomes. So for your African schistosomes, we have your S. mansoni, which is known as your Manson's blood fluke. They are found or they can be found in Africa and South America. For S. hematobium, they are known as the bladder fluke, the vesicle fluke, or the kidney fluke. So, as the common name implies, they are situated, no? They tend to reside on the kidney, particularly sa urinary bladder. Um, for S. intercalatum, they are found on the west side and central portion of the Africa. Okay, for Asian schistosomes, we have your S. japonicum, which is predominantly present, no, in the Philippines. It is otherwise known as the Oriental blood fluke. For S. mekongi, it is found naman in Mekong River Basin. It is the longest river in Asia. Okay, so let's start with adult. Okay, so its main characteristic, it is, as what I have said, it is round, no, and cylindrical, elongated and cylindrical. So its cylindrical body is covered by a thick tuberculated tegument. So here, except for your S. japonicum, which possesses a smooth tegument. Okay, so here, yeah, tuberculated, it's like protuberance, no, present. And for the female, on the right side here, it is slightly longer and slender compared to the male, which is thick and thick siya and short. Okay. So for the male, guys, it has its gynecophoral canal or the sex canal on the ventral side. Um, for the purpose of holding the female during copulation. So it's like hugging the female adult worm during copulation. Okay? So for their larvae, so as what I have said, it has a forked tail, no, cercaria. So this cercaria has an oral sucker here on the anterior end and a small ventral sucker here, no, for its attachment. So um, for them um, to penetrate the skin of human host. So first, the ventral sucker will use its will will attach, no, to the skin surface, and then this one it releases sa iyang oral sucker, it releases enzyme. Okay, so um particularly the elastase nga enzyme um in penetrating the skin, no, or the human skin. Okay, so during the penetration, its tail tends to detach from its head, okay, or from its um, yes, from its head, having those suckers. So this now, after penetration, this is now called schistosomule, cercaria minus the forked tail. Okay, so usually they swim at the surface of the water and they are released at night from where the intermediate host is more active and uh, mobile. Okay, so that is for the cercaria. So for its eggs, no, so generally your schistosoma eggs are non-operculated. Okay, so there's no operculum present, and there has a spine-like projection here. So eggs are fully embryonated when excreted in urine or feces that hatch out immediately to form miracidia. So let's start with S. japonicum. So it is oval and it has a minute lateral spine here, or this is a knob-like structure. Okay, so this lateral spine is otherwise known as the spicule. And take note, it is acid-fast negative, okay, under modified Ziehl-Nielsen. So we can perform that one if we tend to do biopsy, if we tend to perform histopathological sectioning of the tissues. Okay, so um, your S. mekongii naman, it is looks very much like with S. japonicum egg, wherein it has as well lateral spine, but may be difficult to see. Okay, so this one. So it is if schistosoma japonicum is spherical, your mekongia is subspherical. Next, we have your S. hematobium. So S. hematobium, it is elongated naman with a terminal spine. So take note, elongated with a terminal spine, and it is acid-fast negative. So if present ni siya, it is usually easy to identify because biskan magsuli-suli ang egg, makita mo man Japon ang terminal spine. Okay, so this is usually found or commonly found in the urine. Okay, your S. intercalatum is similar to your hematobium, elongated with terminal spine as well. However, it is acid-fast positive. Okay? And for your schistosoma mansoni, it is elongated with prominent lateral spine, no, on the side here. So this can be difficult to this can be difficult to be seen, no, if mag-turn ang egg. So you can move naman the egg by touching the cover slip, okay, while examining it under the microscope. So um your schistosoma mansoni, it is otherwise considered, or it shows a profile of a man, no, if you agree. So Mansoni. So it's like having this profile of a man. And then for your S. japonicum naman niya, amo na ako no, if japonicum or from Japan, it's quite small. Okay, kesa sa Mansoni naman niya, it's quite big. So it's just like ano lang clue or hint. Okay. So for the intermediate host, we have your Oncomelania, we have Bionfalaria, Lithoglyphopsis, and Bulinus. So your Oncomelania is common for S. japonicum, your Oncomelania hupensis quadrasi. Okay, for your S. mansoni, it's Bionfalaria. For this one, this is for Mekongi, and for Bulinus, for your Hematobium and Intercalatum. So amo to siya, the miracidium able to penetrate these intermediate hosts by its movement, no, and its lytic action of cephalic gland secretions. Okay, so the miracidium will develop into cercariae, okay, inside the intermediate host. The limiting factor of cercariae that develop from one miracidium is the size of the snail. So for S. japonicum, it tends to develop, or it tends to produce a quite um, lesser numbers of miracidium of cercaria rather, comparing it to S. mansoni and S. hematobium, which produces thousands of cercariae. Since there's snail host, okay, your bulinus, and we have your Bionfalaria, they are quite bigger or larger compared to S. japonicum. That's why they can produce more numbers of cercariae. So for the life cycle, so again, after penetrating, no, if after the skin, the cercariae will penetrate the skin of the human host, so it lives it will start, no, with the schistosomule, no, and then the cercariae will or the schistosomule will migrate through the tissues and liver sinusoids, okay, in the liver, and then um, the worm begin to mature into adult, okay. So after siya sa liver sinusoids, guys, makadto na siya or mature na siya into adults, particularly for S. mansoni. Okay, for S. mansoni sa may mesenteric veins ng large bowel. That's why it is pointing out here in the colon, in the sigmoidorectal in the sigmoidorectal region. And then for your S. japonicum, here naman sa intestine, okay, small intestine in the superior mesenteric vein. And for your ace hematobium, we have on the um, vein surrounding the bladder, okay, or pelvic plexuses. Okay, so then the male worms, no, after they mature there, um, they will copulate with the female, and then they will lay um, embryonated eggs. But guys, take note, pag mag-lay ni sila guys ang eggs, usually ano pa na immature pa na siya. No? So it will take pa approximately 8 to 10 days to develop into a mature miracidium, no, inside the egg. And then amo na dayon, the eggs work their way through the tissues, no? Ang eggs na guys, um, they will tend to be to pass through um, tissues, no, into the up to the lumen of intestine to be released from the body in the feces. So this egg migration through the tissues is facilitated by the release of enzyme by the miracidium through the eggshell. So that's why it causes lacerations, it causes inflammation on the tissue. Okay? So fully embryonated eggs will be passed in the stool or in the urine. Okay, so on reaching water, the eggs hatch, liberating miracidia, and then the miracidia will penetrate the intermediate host and then develop to form cercariae later on, and then um, the cercaria infested water will or the cercaria will penetrate again human host. Okay. Okay, so your the clinical disease or manifested by schistosoma, it is known as your schistosomiasis or known as your bilharziasis, or bilharziasis is otherwise known as your urinary schistosomiasis for your S hematobium. Okay, it was called bilharziasis because it was first discovered by Theodore Bilharz in a cadaver of an Egyptian. Okay, so first let's talk about the cercarial dermatitis. Cercarial dermatitis is otherwise known as the swimmer's itch. Okay, so it is associated with penetration of cercaria. It shows urticarial rash, diarrhea at the end of this period. So it is this redness no on the invasion site is caused by an immediate hypersensitivity reaction. Next, we have your acute schistosomiasis, which is known as your Katayama fever or snail fever. It is associated with heavy primary infection, so it depends on the number of cercaria infected to the human host. So these acute schistosomiasis, your um, um, this includes your schistosomal migration down to maturation. Okay? So, and the initiation of the egg production or up until na start na siya maglay sang eggs. Okay? So these, it resembles the symptoms of serum sickness, which is a type 3 hypersensitivity reaction. So it includes high fever, eosinophilia, dysentery, or hematuria. Dysentery in cases of S. mansoni and your S. japonicum, since their eggs tend to um, uh, cause some damage um, towards the tissues no found near the intestinal lumen. So after siya nga ma-release sa intestinal lumen from the mesentery, so definitely may mga lacerations na siya that causes bleeding. And for hematuria in cases naman of your um, as hematobium, no? So there's a blood or there is a bloody urine present for S hematobium. Okay? So um, for the chronic schistosomiasis, so we have the granulomatous reaction towards the eggs. Okay, so after the eggs are deposited in tissues, because not all eggs naman um, will be released no from the lumen or from the urinary bladder. Some of them will be stocked no in the tissues as they go towards the lumen no and in the bladder. So these eggs will expose their antigens no. This will invoke immune response that includes the formation of granulomas around the eggs. Okay, so um, these granulomatous reactions will cause damage um, to the liver. Okay, paano ma-affect ang isa ka liver because possible that there are some of them, since are siya sa may blood circulation, um, it can migrate, no? Or ang eggs pala, okay, or ang even the schistosomule can damage your lungs, your liver, no, as they migrate. So for this one, um, it can develop hepatosplenic disease, no, which is the most serious consequence of chronic schistosomiasis. Um, there is hepatosplenomegaly due to that eggs will remain where they are deposited and others are swept into the circulation and filtered out in the liver forming lesions. Okay, so the spleen becomes congested, fibrous reticulum increases, becomes greatly enlarged, mesenteric lymph nodes lose active lymphoid tissue. Okay, so as well as portal hypertension, no, it tends to form thrombose sa aton nga mesenteric and portal vessels, and that causes obstruction and increasing the blood pressure, okay, that may end up to portal hypertension. Okay, so this can for chronic schistosomiasis, it may also end up developing cancer. So for S. hematobium, it causes bladder carcinoma, particularly squamous cell carcinoma. Colorectal cancer naman for S. japonicum. So for the lab diagnosis, we have the stool or urine microscopy. So stool microscopy for S. mansoni, S. japonicum, and in rare cases, we can see as well S. hematobium in the stool sample. For urine microscopy, we have your S. hematobium, and in rare cases, we can see S. japonicum. So eggs may be found in feces as early as 5 weeks after infection. So patients with a low worm burden or old infections may have a very few eggs in the feces or urine. So um, if may eggs na siya guys, to visualize the lateral spines, no, you can tap the cover slip to move the eggs. Okay, so hematobium, we can see um, hematuria or blood on the terminal portion of the three-part voiding urine. So this three-part voiding urine, definitely the first portion coming from your urethra, the second portion from the ureter, and then the last portion is coming from the bladder. So there the third part, no, the third part of the voiding urine is um, we have it is bloody, no, because it is coming from the bladder, and it is due to the lacerations being um, uh, contributed by the terminal spine of your S hematobium. Okay, so for rectal or liver biopsy, S hematobium, bladder mucosal biopsy. Okay, then the rest you can use rectal or liver biopsy. And then acid-fast staining for modified Ziehl-Neelsen stain. So we cannot perform zinc sulfate flotation concentration since the eggs will rupture and it will not float, but instead they are found in the sediment. Okay, FECT is recommended for concentrating eggs. However, it involves fixation, so it cannot be used to detect egg viability. So the best or the recommended concentration technique is the MIFC, methylate iodine formalin concentration technique. So we have as well to quantitate the eggs present in stool specimen. It is done via catho-thick smear technique or catho-cats. So for the treatment, it is praziquantel, giving this or following this dose, no, 2 to 3 doses for of 20 milligram per kilogram every 4 hours and 10 milligram kilogram for 2 days naman, so ga-follow kita sang um, proper regimen. Okay? Okay, so now let's proceed with the next trematode. We have your lung trematode. So Paragonimus is found primarily in the Far East, such as China, Japan, Korea, Papua New Guinea, and Southeast Asia. So there are lots of species of Paragonimus, but Paragonimus westermani is the most common and widely distributed lung fluke. Paragonimus mexicanus are found in areas of Mexico and South America, and your Africanus and Utero bilateralis is found in West Africa. Your Paragonimus canicoti is found in North America. So let's start. So your Paragonimus westermani is also known as your Oriental lung fluke. So its main habitat is that adult worm lives in the parenchyma of lungs. So affected ang aton nga lungs if you are get infected with Paragonimus westermani. So you will be manifested with the clinical disease known as paragonimiasis. It is also known as your lung fluke disease, pulmonary dystomiasis, endemic hemoptysis, or parasitic hemoptysis. So this is very consistent with PTB. So it is often misdiagnosed as tuberculosis. So for us to differentiate P. westermani infection from pulmonary TB, we will perform acid-fast staining. Okay, so your tuberculosis will be the acid-fast. No, there will be acid-fast bacilli present. So for the mode of transmission, it is or the man acquires or human host acquires infection by eating uncooked, partially cooked, salted or pickled crab or crayfish, no? Or its a second intermediate host. So in the Philippines, very common ang transmission through eating sinugba or roasted crab or eating kinilaw, mga raw or uncooked na mga na crab, okay? So its infective stage is metacercaria, present sa aton nga second intermediate host. So here in the Philippines, we have your mountain crab, Sunda telfusa filipina, otherwise known as or formerly known as Parathelfusa grapsoides. Um, for the first intermediate host, we have the snails such as the Antimelania asperata or formerly known as Brosia asperata, and we have your Antimelania dactylo. So this picture, this is an example of your Antimelania asperata, and this one is the Sunda telfusa na Filipina, Sunda telfusa Filipina nga crab. Okay? So mga mountain crab na sila. So for the morphologic characteristics, so its adult shows plump, or when we say plump, it's fleshy like, okay? So plump, ovoid, reddish brown fluke found encapsulated in the lungs, okay? So since the adult worms live in the lungs and there they will produce eggs that may be present in sputum if i-expectorate sang patient or sang individual ang sputum and then swallowed back, it may be present in the feces. So, um, its adult form, it is broader. It has a broader anterior end, okay, resembling a coffee bean shape. Okay, so for the eggs of Westermani, it is often confused with dilatum egg since it is operculated, unembryonated, and somewhat similar in size. However, unlike with your Diphyllobotrium eggs, your P. westermani eggs have opercular shoulders. So this one differs your P. westermani from that of Dilatum. Okay? So it has opercular shoulders, and take note guys that in its posterior end, no, in its ab opercular no? This is the operculum. So the opposite side, it shows um, thickened shell, no? It shows a thickened part here. So as you can see, for your dilatumia, um, it has opercular, opercular knobs. Okay, Dria, thickened shell siya. Okay, so that's for the morphology characteristics. Now let's proceed with the life cycle of the Paragonimus wistermani. So, just follow na lang the diagram from CDC. So the eggs escape from the encapsulated tissue through the bronchioles. Okay, so here it will be coughed up, or it will be passed out in the feces, no, upon expectoration and then swallowed back. So the embryonated eggs hatch in water 2 to 3 weeks to release the miracidia, which penetrate the fresh water snail. Okay, so your Antimelania species. So in the snail, the miracidia develop to the cercarial stage, no, but it will follow pa sporocyst radii. Okay, so these cercaria will invade the crustacean via the gill chamber or on ingestion of an infected snail. So they can be infected if they tend to eat these intermediate host, or via mismo ang cercaria amo ang ma-invade, no, sang ilang gill chamber. So human ingest inadequately cooked or pickled crustaceans containing metacercaria, and then the metacercaria will exist in the duodenum, and the larvae penetrate the intestinal wall and migrate to the abdominal cavity, diaphragm, and pleural cavity down to the lungs. Okay? So the larvae mature to adults in the vicinity of bronchioles, where they discharge their eggs into the bronchial secretions. And then, again, makomplete naman siya by expectorating unembryonated eggs, and then or through defecation. Okay? So this picture shows an example of crab gills containing metacercariae, or infected with metacercariae. Okay, so let's proceed with the clinical disease. So guys, metacercariae of Paragonimus penetrate the intestinal wall and migrate to the abdominal cavity. This may cause abdominal tenderness, nausea, and vomiting. Then they migrate to lungs and develop to adult worms that cause pulmonary paragonimiasis. So what is happening here during pulmonary paragonimiasis? The adult worm initially causes eosinophilic granulomatous infection or inflammation in the lungs, which leads to the formation of encapsulating fibrotic capsules or cysts, no, surrounding the worms. So the cysts are commonly found on the right lung. Okay? So as the cyst rupture, a cough develops, no? So there will be chronic cough associated for pulmonary paragonimiasis. So there will be an increased production of viscous blood-tinged sputum. That is what we call your hemoptysis. It shows a rusty sputum, which may have a foul fish odor and increasing chest pain, no? Due to the um, friction, the urge to cough, no? So forcibly, no, forcibly ang pag-cough naton. So for cerebral, aside from pulmonary, it can also capable of causing extrapulmonary paragonimiasis. So it is the very ano ginadi guys, ang pinaka risky ginadi is by affecting, no, the brain, no, or the central nervous system. So it causes cerebral paragonimiasis. So occasional siya. However, take note, it causes cerebral hemorrhage, edema, and meningitis. No, sorry, kulang na the end. So meningitis. So it may end up patients having motor weakness or in epileptic um, epileptic nga mga seizures. Okay? So that's for the Paragonimus westermani. Okay, so to diagnose P. westermani, so we will perform sputum microscopy. So Paragonimus eggs may be recovered from sputum, pleural effusions, and occasionally in feces. So we can perform um, sputum concentration treated with 3% sodium hydroxide, and repeated sputum examination is performed up to 3 times on different days. Okay? When looking at sputum specimen for eggs, it is necessary to carefully examine any blood-tinged flecks for eggs. Okay? So, mas amo na siya ang i-examine naton because surely no um due to its chronic coughing of the individual, so that guys gaka-release ang eggs naton or mainly makita ang eggs naton. So the eggs may be observed in a wet mount with or without iodine stain. And take note that together with your ova of the Paragonimus species, it is also common to see any charcoal-laden crystals, no? These charcoal-laden crystals are slender and pointed at both ends. These crystals normally appear colorless and stain purplish to red with trichrome stain. So what is this charcoal? This is indication that ano siya, this is a product actually, this is a product of your eosinophils. So definitely if you get infected with Paragonimus westermani, which is a parasite, so definitely there will be eosinophilia. No? That's why may peripheral blood eosinophilia ikaw. Okay? So you can perform or you can check as well for any lung lesions under X-ray, MRI, CT scan. So elevated ang serum IgE, and we have your immunodiagnostic test we can also perform, such as your immunoblot assay, no, to detect the antibodies of P. westermani. Okay? So for the treatment, no, the drug of choice of P. westermani is praziquantel and and alternatively we can use triclabendazole. Okay? So let's move on to the intestinal trematodes. We have your Fasciolopsis busci, Echinostoma ilocanum, your Artifekinostomum malayanum. Artifekinostomum is synonymous to Echinostoma. So these are echinomastids, no? So we have as well your heterophayids na mga flukes. We have your heterophyes, and Metagonimus yokogawai. So these intestinal trematodes are parasites of vertebrates. So they are hermaphroditic, dorsoventrally flattened, and then they vary in size from the barely visible heterophyes. So that is there are from smallest to largest are sa intestinal, no? So we have Fasciolopsis busci and we have your heterophyes. Okay? So let's start with Fasciolopsis busci, or your giant intestinal fluke. So it is the largest and the most common intestinal fluke infecting man, and it was first noted by Busk in 1843 in the duodenum of an East Indian sailor. So the mode of transmission is ingestion. Its definitive host, no? We have the pigs and humans. Okay, so reservoir host for Fasciolopsis busci, we have dogs, pigs, rabbits. First intermediate host, we have snail, Segmentina or Hippotis species. So this one is an example. And we have your second intermediate host. So we have your freshwater vegetation. So guys, we can acquire this one by eating or ingesting freshwater vegetation. So we have your water caltrop or your Trapa bicornis, your Eleucara tuberosa, water chestnut, your Ipomea aquatica, water morning glory, and Nymphaea, lotus. So those are the second intermediate host. So, the habitat of your Phaseolopsis busci, it is mainly found in the mucosa of the duodenum and jejunum of man and pig. So, this one are the second intermediate hosts of your F. busci. We have here bamboo shoots. We have here an example of lotus. This is an example of water chestnut. So, this is being ingested. And then water morning glory, here your kangkong, and we have here your water caltrops. Okay, so this one. So these are all water or freshwater vegetation. So this is where we can get the Metacercariae of your Phaseolopsis busci. So now let's talk about the morphologic characteristics of F. busci. So to start with, its adult worm, it shows a fleshy, dark red, elongate ovoid with no cephalic cone as seen in Fasciola species. So this is a kind of similar, no, or closely resembling fasciola na trematode. However, it has no cephalic cone. So what is that cephalic cone? So if you can see here, its mouth, no, the anterior end here, um, naga-ano siya guys, naga-continue siya, no? There is just light concavity here na naga-curve na di siya ho, pakadto siya nga body. So unlike ya with your fasciola, yeah, it's very prominent nga naga may base ginadi guys and then naga-flat pa na diyo. Okay, so something like this. So here and then naga-flat pa na di and then here. So that is for your um fasciola. So for your ano ya, for your Phaseolopsis busci, so continuous siya yan, no? So that's for the adult worm, no? So this one is an example of a carmine stain. Basi magwonder ka mo nga hindi siya dark red, hindi siya fleshy because this is stained with carmine stain. Okay, so eggs are operculated, no? Operculated, yellow-brown, and unembryonated. So this is indistinguishable from the eggs of Fasciola species. Okay, so the operculum is found at the more pointed end of the transparent eggshell. So check mo siya, makitang operculum sa pointed nga side. Okay, pointed na end. So the less mature the egg, the more difficult it may be to see the actual operculum. So it blends on the shell outline, no? So difficult naton ma-identify because there's no such as breaks in the shell here. So hindi naton makita do part siya sang shell Japon ang aton operculum. Okay? So take note as well that the Phaseolopsis busci egg is characterized by hen's egg shape. So do itlog siya guys sang manok, no? Hen's egg shape. Okay? So that's for the Phaseolopsis busci. Take note, maghambal ta fascio, they are acquired through, gintawag siya fascio because from the word fascia, it means bundles of freshwater vegetation nga plants. So, similarly, your fasciola can also be acquired through ingestion of your freshwater vegetation. That's why gintawag siya fasciola, area Phaseolopsis. Okay? So for the life cycle, so first, unembryonated eggs are passed in feces of humans or pigs. Depending on the temperature, the eggs will embryonate in water within 3 to 7 weeks. And then once in the water, the mature miracidium hatches from the egg and tries to locate the appropriate snail species to infect. Okay, so in the snail, the miracidia begins to develop into a first generation sporocyst, followed by radiae up to the cercarial stage. Then the Phaseolopsis radiae develop um, Okay, um, after nga mangin Cercariae siya, the Cercariae will escape from the snail host into the water, and then the Cercariae will insist on water plants such as water caltrops and etc. So, there, ma-develop sila into metacercariae in approximately 4 weeks, and then humans become infected by ingesting the raw or undercooked plants containing the metacercariae. Then the metacercariae inside the human host will exist, attached to the duodenal or jejunal mucosa, and develop into adult worms within 3 months. So the adult lifespan seldom exceeds 6 months to a year, no? So that is the life cycle of your Fasciolopsis busci. So for the clinical disease, so in light infection, guys, it may be asymptomatic, or due to the attachment of worms to the mucosal wall, it produces local inflammation, such, and there will be ulcerations with mucus and blood in stool. So definitely it will show dysentery, no? There will be bloody and mucus filled nga stool sample. Okay? So, in heavy infections naman, they may be found in the stomach, no, and most of the intestinal tract. So, this causes bowel obstruction. So, if we try to look this one, this is an example of an intestine um, containing with your Fasciolopsis busci. That's why obstructed na ang intestinal lumen. So, as well as there will be edema of the face, no? Edema not only in the abdomen but as well as the face, no? So this is a result of hypoalbuminemia. Naganubo ang protein sang pasyente, secondary to malabsorption or protein losing enteropathy. So due to obstruction, due to the presence of adult worms, absorb nila ang imo nga protein, so naganubo ang albumin naton. And take note that albumin is responsible for oncotic pressure. So definitely there will be edematous tendency, no? And with profuse yellowish green nga stool. Okay? So this malabsorption will end up impairing your vitamin B12 absorption. So this could lead to a low vitamin B12 levels. Okay? So aside from this one, there is also a marked eosinophilia and leukocytosis. Diagnose your Fasciolopsis busci, so we can perform stool microscopy. So it can be through a wet mount or a direct microscopy. We can also perform sedimentation concentration technique. So FECT is recommended for egg recovery because operculated eggs like your Fasciolopsis busci do not float in the flotation technique. Okay? So adult worms are rarely seen, particularly if heavy ang infection. Okay? So here sa picture, it shows the presence of Fasciolopsis busci together with the unholy three. Okay? So the treatment, we have praziquantel as well. Okay? So now, another intestinal fluke, we have your Echinostoma ilocanum and Artifekinostomum malayanum, or your E. malayanum. So a number of species of echinostoms have been reported to infect human. Okay, 2 species reported in the Philippines. So these are the 2. So most of the species are found in oriental countries. So for your E. ilocanum, otherwise known as your Garrison's fluke, it was called Garrison's fluke because it was the infection manifested by E. ilocanum was first noted by Garrison in 1907 among Bilibid prisoners. No, so it was discovered here, no, in the Philippines. So E. ilocanum is the most important species among all echinostomes. Okay, so mode of transmission, we have ingestion, definitive host, and your reservoir host. So we have your dogs, your cats, pigs, no, rats, okay, even rabbits, okay. So humans can also be infected by your E. elocanum and A. malayanum. So the first intermediate host, we have your um, Gyrolus convexusculus and Hippotis umbilicalis. Your second intermediate host is snail again. So this is unique for your Echinostoma and A. malayanum because both in the first intermediate host and the second intermediate host are snails. No? So its second intermediate host, we have your Pila luzonica. This is the kuhol, no, in the Philippines. Okay, and Vivipara angularis or the susung pampang. So these two are the second intermediate host of your E. elocanum, while the remaining two, Limnea cumingiana and Ampullarius canaliculatus, are the second intermediate host of your Artifecanostomum malayanum. Okay, so now let's discuss the adult morphology of your E. elocanum and A. malayanum. So your E. elocanum, actually both of them have a similar characteristics, no? So reddish gray and has a circumferal disc surrounding the oral sucker, no, containing spine. So this picture shows a circumferal disc of E. elocanum. So they only differ based on the number of the collar spines surrounding the oral sucker. So for E. elocanum, it has 49 to 51 spines, while A. malayanum, it has 43 to 45 collar spines. And take note that A. malayanum is quite larger and longer comparing it to your E. elocanum. Okay, so here, for these adults with light infections, the patient may be asymptomatic and the adult worms cause only minor problems other than localized inflammation. While in heavy infections, the worms can produce catarrhal inflammation and mild ulceration, and the patient may experience diarrhea and abdominal pain. So definitely there will be intestinal problem, okay, intestinal disease. So for the eggs of the two, E. elocanum, they are both operculated. Okay, so ellipsoidal, yellow-brown, kag unembryonated. While your A. malayanum is larger compared to E. elocanum and it has golden brown color. So E. elocanum eggs are considerably smaller than Fasciolopsis busci, no? That's what, because they tend to have a similar characteristic. So smaller lang niya ang E. elocanum kag some strains of E. elocanum produce eggs that overlap in size. That's why ma-confuse ka man with Fasciolopsis busci. Okay? So, for the life cycle, the adult worms attached to the mucosal wall of the small intestine will lay their eggs, which are passed from the intestinal lumen in the feces. So, the miracidia take 1 to 2 weeks to mature in okay in the environment before they hatch from the eggs and infect the first snail intermediate host. So, in the first intermediate host, it will um, there will be two or more generations of Ridiae, and then um, A. malayanum naman niya, okay, for E. elocanum, two or more generations of Ridiae are produced before mangin Cercaria. Okay? While the A. malayanum, its miracidium first develops into a sporocyst. Mas sporocyst siya, guys. Ang A. malayanum, then mother radiae, and then daughter radiae and cercariae. Take note, guys, wala sporocyst si A. elocanum. Okay? So the Cercariae insist in freshwater mollusk, the second intermediate host, and then the humans are infected by eating these mollusks raw rather than cooked. So the Metacercariae will hatch in the intestine, attach to the mucosal wall, and develop into mature adult worms. So to diagnose A. elocanum and A. malayanum, we can perform stool microscopy, direct mount, and sedimentation concentration technique. Treatment still praziquantel. For the heterophyes, and metagonymous Yukogawai, or the heterophyid flukes, so these two flukes, they occur in Japan, Korea, China, Philippines, and Western India. So your heterophyes, or otherwise known as the von Siebold's fluke, is considered as the smallest but the deadliest fluke. Okay? So the mode of transmission is ingestion of your second intermediate host, which is brackish. Okay? So this brackish water, this is with a genus Mugil and species Capito. Okay? So also you can acquire by eating fresh and marine or salt fish. Okay? Saltwater fish. Okay, so for its first intermediate host, freshwater snail, for heterophyes is Pyrinella conica and Ceritidea species. For Metagonimus, we have Semisul cospira species. Okay, so that's for the for your heterophyid flukes. So to talk about more, we have the adult characteristics. So Heterophyes shows a gray with a round, broad posterior end and possesses three suckers. No? We have the oral, the ventral, and the genital sucker, or the gonotile. For Metagonimus, it has only two. Okay, it has only two suckers, guys, oral and ventral lang. And also one of their differentiating characteristic is that if we try to look the ventral sucker of your heterophyes, it is situated on the left side, comparing it to your metagonimus, which is situated on the right side. And the ventral sucker of your metagonimus is quite larger or bigger comparing it to heterophyes. Okay, so this one, no, broad siya guys, ang posterior end. Diriya guys, yeah, it's kind of rounded na posterior end. So the eggs, they have both similar eggs. Okay, so small, yellow-brown, embryonated, and operculated with very subtle or slight opercular shoulders. No, that's why is your heterophyes, guys, is quite similar to your Clonorchis and Opistorchis nga egg. So this one is an example of Clonorchis sinensis nga egg. So if you can see, there is shoulders and there is opercular knob. So diriya, may ara man siya shoulders pero less prominent or slightly visible siya. So as well, your heterophyes does not have an abopercular protuberance in contrast to your Clonorchis and Opistorchis. Okay? So, Metagonimus naman niya, to differentiate it with your heterophyes, ang eggs ng Metagonimus have inconspicuous also nga opercular shoulders but a more obvious nga operculum. So mas obvious ang operculum sang aton nga Metagonimus compared to heterophyes. Okay? So for the life cycle, adult worms lay embryonated eggs in the intestinal lumen and the eggs are discharged into the environment via the feces. The eggs are ingested by the snail intermediate host before the miracidium hatches. A sporocyst and one or two rhenia generations will develop in the snail before the production and release of cercariae. Then these cercariae will insist under the scales or in the flesh of freshwater fish, and then humans become infected by eating raw, pickled, or poorly cooked fish containing the metacercariae. Then the metacercariae will exist in the intestinal tract attached to the walls of the small intestine and grow to mature. Okay, so that's the life cycle of your um, echinostoma and artificinostomum. Okay, so for the clinical disease of your echinostoma, we have light infection, asymptomatic. Kung heavy infection, it causes dysentery, intestinal ulcers. That's why it causes peptic ulcer disease, no, due to the invasion of the adult worms sa aton nga intestine, and also causing abdominal pain. Because of the small size of the eggs and the fact that the adult may attach itself deeply into the intestinal wall, some of the eggs, guys, may end up in the general circulation of the host. So, diin maagi ang eggs sa aton nga blood vessels surrounding the intestinal wall. So, the eggs may provoke pathologic lesions, particularly in the heart and brain. So, here in the Philippines, 15% of fatal heart disease may be a result of heterophaid myocarditis, and there have been reported that that echinostoma infection manifests neurologic problems due to the deposition of eggs sa brain kag presence of adult worms. So to diagnose, we can perform stool microscopy looking for the eggs, no, of your echinostoma. So wet mount and concentration technique. Okay? So adult worms are rarely seen. So guys, the eggs of different heterophyid species are difficult to distinguish. So care must be taken to distinguish them from Clonorchis and Opistorchis. So you observe the abopercular knob, no, for your Clonorchis, and then absence naman siya with to your to your echinostoma. Okay? So, perform cathodic method for quantitation of eggs and treatment praziquantel. So, next, let's move on to the last classification. We have your liver trematodes, which includes your Clonorchis sinensis, your Opistorchis species, your Phelineus and Viverini, and we have your Fascioles species, your Hepatica and Gigantica. So these trematodes parasitize the biliary ducts of humans. No? So Clonorchis and Opistorchis species are narrow, elongate worms that localize in more distal, smaller ducts of the biliary tree, while your Fasciola hepatica, because of its much larger size, it resides in the larger bile ducts and gallbladder. Okay, so this is of great public health concern because of its causing its ability to cause cholangiocarcinoma, no, or cancer of the bile duct. Okay, so we will discuss them one by one. So your Clonorchis sinensis, or your Chinese or Oriental liver fluke, its adult worm was first described in a Chinese patient who died in Calcutta, India. So this is the most important liver fluke of man. Okay? So its mode of transmission is ingestion. Its definitive host dogs, cats, other fish-eating mammals, so included na ta ang humans. Then the first intermediate host, we have the snail. So for Clonorchis, it has actually, guys, 100 species of snails, but these are the common. So we have your Paraphosarulus, Manchourucus. We have your P. anomalus spiralis, P. stratulus. We have your Bulinus striatulus, Semisulcus spira, also Alosinma longicornis, your Thyara granifera, your Melanoides tuberculatus. And the second intermediate host, we have your freshwater fish. Okay, Cyprinidae. So this is similar to your Echinostoma, ha? Echinostoma, freshwater fish man. Okay, so habitat, adult worm lives in the bile duct, pancreatic duct, and common bile duct of man and other domestic animals. Okay, so we have the characteristics of the adult worm. So it is flat, transparent, and spatulate body. No? So pointed anteriorly and rounded posteriorly. So this is much smaller comparing it to the fasciola nga parasite. So its eggs, it has a seated operculum. So if you try to look, its operculum, guys, and its opercular shoulders is very prominent. Prominent yun siya, guys. So that's why ang operculum niya, it's like nagatungtong siya sa babaw sang aton nga shoulders, no? So that's why may ara siya nga characteristic niya seated operculum. So, it contain a small comma-shaped appendage at the abopercular end, or it is known as the abopercular knob. So, guys, its egg, naga-resemble siya, guys, with an old-fashioned electric bulb. So, guys, it is very, very obvious. Kung lang tawon mo, guys, ang iyang ang iyang image, no, ang iyang appearance closely similar gid with the old-fashioned um, electric bulb, no, together with its here, no, ang iyang abopercular knob, so similar gid. So that's the difference, no, of the eggs ng aton Pleunorchis sinensis. It's prominent shoulders, no, prominent shoulders. So for the life cycle, so fully embryonated eggs are discharged with the bile fluid into the feces of infected human. The eggs in water are ingested by freshwater snail, at which time the miracidium hatches to infect the snail. Okay, so sporocysts and rhedia generations are produced before cercariae. Then the free-swimming cercariae released by the snail will insist in the skin or flesh of freshwater fish. Then humans become infected by ingesting the metacercariae present in uncooked fish. The metacercariae will exist in the duodenum, enter the common bile duct, and travel to the distal bile capillaries where the worms mature. Okay? So, sa liver ang iyang organ affected. So, clinical disease. So, light infection asymptomatic, but for heavy infection, guys, it causes biliary obstruction. That is due to the irritation um, released or irritation produced or resulted from the toxin released by the adult worm. So, diri na di guys gaagi. So, it can be um, um, here, this is intrahepatic. So, sa sulod, no, pwede man guys extrahepatic sa sagwa, no, nga bile duct. Okay, so here maagi na di ang aton nga adult worm and then ga-release sa toxin nga naga-cause cholangitis or inflammation of the bile duct. So that causes thickening and localized dilations of the bile duct with hyperplasia of the mucinous gland. So definitely the irritation will cause change in the tissue, no, sa lining naton, that causes hyperplasia, and there will be fibrosis, no, definitely. So this fibrotic hyperplastic picture, no, or manifestation will surely end up causing obstruction. So this the bladder, no, hard to, or the bile produced by by the liver is hard to be released to the intestinal lumen that causes jaundice, no, so obstructive jaundice. And take note that C. sinensis has been linked to neoplasms of the bile duct, no, and this is known as your cholangiocarcinoma, a malignant tumor that arises from the bile duct epithelium and is second most prevalent liver cancer after hepatocellular carcinoma. So definitely this hyperplastic nga mga nga manifestation, this could end up forming tumor, no? So there is a risk factors for individuals now with pre-existing primary sclerosing cholangitis. So ano guys, contribute pagid more ang cholangitis nga gina-cause kung infected ka sang Clonorchis sinensis. So mas nagadasig ang formation sang malignant tumor causing cholangiocarcinoma. Okay? So, laboratory diagnosis, stool microscopy by wet mount and sedimentation concentration technique. Okay, so eggs may not be found in stool from patient with biliary obstruction. So, also, this can, your liver lesions, no, at presence of tumor can be seen or visualized by performing cholangiography, ultranosonography, and liver CT scans. And we can also perform multiplex PCR to the target's mitochondrial DNA in identifying it if you are infected either with heterophagus, no, clonorchis and opistorchis, no. So amo na siya. Treatment, praziquantel, and as an alternative drug, we can have albendazole. So for your Opistorchis species, we have your cat liver fluke, your Opistorchis velineus, and your Opistorchis viverini, your Southeast Asian liver fluke. Okay, so mode of transmission is ingestion, definitive host, and its reserva host, dogs, cats, and other fish-eating mammals. Its first intermediate host snail, your Bithynia. So different from your Clonorchis, ya damo-damo to siya guys nga intermediate host area, your Bithynia. Common gid siya guys with Bithynia snail or Cordiella, or also known as Cordiella. And then the second intermediate host, the freshwater fish, same lang Cyprinidae. But for your Opistorchis velineus, we have reported nga we have the freshwater fish nga tingka-tingka or barbus-barbus. Okay? So life cycle is similar to that of Clonorchis sinensis and associated man siya guys with cholangiocarcinoma, and the treatment is praziquantel. So let's talk about that adult, okay, of your Opistorchis species. So your Opistorchis adult, elongated and dorsoventrally flattened, similar to that of Clonorchis sinensis, except that it is smaller. Okay? So, your eggs sang Opistorchis are operculated with very prominent shoulders. Similar gid siya guys with Clonorchis. May ara man siya guys opercular knob, kag embryonated siya. So, this can only be differentiated because its operculum is more deeply seated, no, more deeply seated compared to your Clonorchis sinensis. Okay? So now, with the last liver trematode, we have your Fasciola species. So we have two guys common, hepatica and gigantica. Fasciola hepatica, or your sheep liver fluke, also known as your temperate liver fluke or your common liver fluke. While Fasciola gigantica is the giant liver fluke. So from the word giant, it is more larger compared sa Fasciola hepatica, both sa eggs kag sa adult worm niya. No, dako gid si Fasciola gigantica. So mode of transmission, ingestion, and the definitive host, sheep, goats, cattle, humans. So for the sheep guys, this is common to Fasciola hepatica, and for cattle, very common for gigantica. Okay? So first intermediate host snail for hepatica, it's Limnaea truncatula. We have Limnaea bulmoides and Limnaea tomentosa. For gigantica, we have Limnaea auricularia, Limnaea acuminata, and Limnaea natalensis. Okay? So, its second intermediate host, as what I have said earlier, no? or previously that fasciola, gintawag siya fasciola because it can be acquired as well from freshwater vegetation or bundles of freshwater vegetation. So we have your watercress, Nasturtium officinale, and water morning glory, Ipomea obscura, and water chestnut. So ang habitat ng fasciola, the parasite resides in the liver and biliary passages of the definitive host. Okay? So to differentiate your fasciola, hepatica, and gigantica, both of them, guys, are flat, transparent, spatulate body, pointed anteriorly, and rounded posteriorly. Okay, so for your fasciola, hepatica, ang cephalic cone niya, guys, magamba ta cephalic cone, this one. Okay, this is the cephalic cone together with the base. So here, guys, it has a marked widening at the base of the cone. Okay, so diriyo, guys, mas naga-expand di siya, guys, ang iya nga cephalic cone. While your fasciola gigantica, guys, this one is less, no, less ang iya nga cephalic cone, no, less prominent. Okay? So that's for your fasciola gigantica, it is more larger comparing it to fasciola hepatica. Okay? Shorter si hepatica, longer si gigantica. Okay, so take note ha, differentiating characteristic ang ila cephalic cone. May cephalic cone sila duwa, less prominent lang, aria very prominent. Okay, wide based sang cephalic cone. And for the eggs, operculated, brownish yellow, and embryonated. Fasciola gigantica is slightly larger than the fasciola hepatica. So eggs resemble those of Fasciolopsis busci. Their eggs, guys, may have thickening at the ab-opercular end of the shell, unlike sa Fasciolopsis busci nga wala. So this one, no, may thickening sa ilang ab-opercular end. Fasciolopsis busci wala. So for the life cycle, unembryonated eggs are passed in feces of infected human, sheep, or cattle. Okay, the eggs embryonate in water, then miracidia hatch and penetrate freshwater snail. In the snail, they undergo development to the cercarial stage, and then the metacercariae on water plants are ingested by human, sheep, or cattle. Okay, then the metacercariae exist in the duodenum and migrate through the intestinal wall into the peritoneal cavity. The larvae will enter the liver by penetrating the capsule or the Gleason's capsule, and there they wander or they tend to stay through the liver parenchyma for up to 9 weeks. The larvae finally enter the bile duct where they mature and produce eggs which are passed out in the feces. Okay? So their clinical disease there is 2 clinical stages. For the first stage, the acute stage, this is due to the larval migration and worm maturation in hepatic tissue. So there is the triad of infection. There is high fever because of their immune response sa ilang antigenic antigenic nga exposure, no? Hepatomegaly, guys, because the liver is affected, it causes inflammation, fibrosis, so naga-enlarge ang aton nga liver and spleen. Then marked eosinophilia. Chronic stage persistence of fasciola worms in the biliary ducts. So this one, guys, this shows fasciola species sa aton nga liver. Okay? And then here, this shows inflammation sa biliary ducts naton sa aton nga liver. So adult worm causes obstruction there. This causes inflammation in the biliary epithelium. That's why here naga-thickening ang biliary. Amo siya, guys, ang thickening of biliary duct. So this causes obstruction, then fibrosis, then biliary cirrhosis. No, there will be scarring and damage to the liver. Okay, so for the diagnosis, tool microscopy by wet mount and sedimentation concentration technique. Ultrasonography, CT scans, and MRI to visualize the lesions, and peripheral blood eosinophilia. For the treatment, it is triclabendazole, and we have the bithionol and praziquantel as alternative drugs. So that ends our discussion for trematodes.